Human metapneumovirus, HMPV, is a respiratory virus that causes illnesses ranging from mild cold-like symptoms to more severe respiratory infections. First identified in 2001, HMPV has been circulating among humans for decades and is found worldwide.
Regarding human metapneumovirus, it's not a new virus, so it's got an unusual name, so there's been a lot of interest. But it is not a new virus. It was first identified in 2001. It's been in the human population for a long time. It is a common virus that circulates in winter and spring. It usually causes respiratory symptoms similar to the common cold.
HMPV was first isolated in the Netherlands in 2001 using the RNA arbitrarily primed PCR technique. However, subsequent studies revealed that the virus had been circulating in humans for at least 50 years prior to its discovery. The virus spreads through respiratory droplets when an infected person coughs or sneezes, close personal contact such as touching or shaking hands, and by touching surfaces contaminated with the virus and then touching the face. In temperate climates, HMPV infections are more common in late winter and spring, often coinciding with other respiratory viruses like influenza and respiratory syncytial virus, RSV. HMPV infection typically presents with symptoms similar to the common cold or flu, including cough, fever, nasal congestion, sore throat, shortness of breath, body aches, headache. While most individuals experience mild symptoms, the virus can cause more severe illness such as bronchitis or pneumonia, especially in infants, older adults, and individuals with weakened immune systems. Generally, HMPV causes mild respiratory illness. However, severe cases can occur, particularly among high-risk groups. The World Health Organization, WHO, notes that while HMPV can lead to serious illness, it usually results in mild disease. Specific global statistics on mortality rates due to HMPV are limited, but severe outcomes are relatively uncommon. In December 2024, China reported an increase in respiratory infections attributed to HMPV, leading to concerns reminiscent of the early COVID-19 pandemic.
International scholars are calling on China to disclose pathogen information and conduct genetic research to confirm that it is not a new virus. Even if it is an old virus, it could still be a new variant.
Despite reports of crowded hospitals, the WHO indicated that infection levels were within expected ranges for the winter season.
There has indeed been a rise in a number of common respiratory infections in the country, and this is entirely expected during the winter. China has a sentinel surveillance system for influenza-like illness and severe respiratory infections. According to the Chinese CDC data, the pathogens causing these infections are known ones, and they include the seasonal influenza virus, the respiratory syncytial virus, also known as RSV, and of course the human metapneumovirus, HMPV, as well as our old friend SARS-CoV-2, the virus that causes COVID-19. Now, among the pathogens reported by China CDC, seasonal influenza is by far the most common that's coming up in all the testing, and it's increasing. The test positivity rate for influenza at the end of December was over 30% among people presenting with the flu-like symptoms in outpatient and emergency department sentinel sites. China's reported levels of respiratory infections are within the normal range. It's what we expect to see for the winter season. Authorities report that hospital utilisation is currently actually lower than this time last year, and there have been no emergency declarations.
The organisation emphasised that the situation did not warrant significant concern, as the virus is known and typically causes mild illness.
流感病毒是常见病原体之一。目前看，中国呼吸道传染病的流行规模和强度低于去年同期。关于你提到的人偏肺病毒，经向主管部门了解，这不是什么新毒株，在人类社会存在超过60年，是引发上呼吸道感染的常见病毒。人偏肺病毒感染表现为自限性疾病，把常见病毒渲染为不明病毒，这违背科学常识，是危言耸听。中国政府始终高度重视本国人民和在华外国公民的身体健康。中方主管部门和技术机构主动开展多种急性呼吸道传染病哨点监测，并公开监测结果。疾控专家也多次介绍科学防护措施。中方也同世界卫生组织保持着密切沟通，及时分享呼吸道疾病的信息。今天的记者会到此结束，谢谢大家。
So our advice to those who are in the winter season is to try to avoid getting ill in the first place, try to avoid getting infected, and simple measures. As we know, we've all been very well trained by coronavirus, by COVID-19.
Preventive measures for HMPV align with those recommended for other respiratory viruses. Regular hand washing with soap and water, avoiding touching the face with unwashed hands, wearing masks in crowded or poorly ventilated spaces, improving indoor ventilation, staying home when experiencing symptoms, covering mouth and nose when coughing or sneezing, cleaning and disinfecting frequently touched surfaces.
Health experts have clarified that HMPV virus is not a new virus. It was first identified in 2001. And it has been circulating in the entire world since many years. HMPV spreads through the air by way of respiration. This can affect persons of all age groups. The virus spreads more during the winter and the early spring months. On recent reports, the cases of HMPV in China, the Health Ministry, the Indian Council for Medical Research, and the National Center for Disease Control are keeping a close watch on the situation in China as well as in the neighboring countries. WHO has taken cognizance of the situation and will share their report shortly with us. The country data for respiratory viruses available with Indian Council for Medical Research, ICMR, and the Integrated Disease Surveillance Program has also been reviewed, and no surge in any of the common respiratory viral pathogens is observed in India. Joint Monitoring Group meeting was held under the chairmanship of Director General for Health Services on 4th of January 2025 to review the situation. The health systems and surveillance networks of the country remain vigilant, ensuring the country is ready to respond promptly to any emerging health challenges.
Currently, there is no specific antiviral treatment or vaccine for HMPV. Management focuses on relieving symptoms, and most individuals recover without medical intervention. Health experts advise against alarm regarding HMPV. The virus is well known, and most individuals have some level of immunity. Unlike novel pathogens, HMPV does not have the same potential for widespread severe outbreaks. Maintaining standard hygiene practices and monitoring symptoms, especially in vulnerable populations, are prudent steps to mitigate its impact. Don't forget to hit like, subscribe, and tap the notification bell so you never miss an update. Thanks for watching. Stay curious.